Welcome to Tagged Beyond the Award, the podcast that celebrates innovation, excellence, and leadership. Each episode dives into inspiring stories behind the nominees and winners of the TAG Awards, uncovering the breakthroughs, challenges, and triumphs that define their journey. Whether it's cutting-edge technology, transformative products, or visionary leadership, we're here to explore what it means to stand out and shape the future of your industry. Let's go beyond the award and into the heart of innovation. Here's your host, Justin Starbird.
Welcome back to Tagged Beyond the Award, where we spotlight the innovators redefining what is possible in healthcare and technology. Today, I'm excited to be joined by old friend Matt Johnson, the CEO of Althing, of the Althing Clinic. Under Matt's leadership, Althing has developed the AIRS system, AIRS, an innovative solution that's setting a new standard for scalable, preventable health and behavioral risk intervention. Their groundbreaking work not only earned them a 2025 TAG Award for MedTech in the healthcare category, but also represents a major leap forward in addressing some of the most pressing challenges in public health, accessibility, personalization, and early intervention. Today, we're going to talk about the vision behind AIRS and how it's reshaping patient engagement and outcomes, and what it takes to build technology that meets people where they are. Matt, hey, good to see you, man. Welcome to the show.
Thanks, Justin. I'm excited.
Yeah, this is awesome. I mean, you and I go back several years. You have been at the forefront of innovation for as long as I've known you. So this is really exciting.
Thanks. Yeah, well, it's in my blood, I guess. But, once you start taking the abuse, you just get used to it.
Yeah, right. It's easier to keep taking it than try something new, right?
Right. Yeah.
Well, congratulations on your TAG Award for MedTech win this year. It was really exciting to see the judges have the same feedback that I saw when I saw your nomination.
Yeah. And, it was nice to share that feedback with us. Those are some very knowledgeable judges. They gave great insights, and we were just excited to be a part of it.
Yeah. Talk a little bit about Althing Clinic and what you guys do. It's a little bit deviation from where you and I met, but you've certainly made some significant inroads and progress in the space. Talk a little bit about what you guys are up to.
Yeah, we have years ago identified an opportunity to make a significant impact on the behavioral health challenge facing students in K-12 systems. When we were able to learn really how bad it was, 1 in 3 students struggles with a significant behavioral health issue every year. It's not just the headlines that you see where there's violence in school, but there's this deep despondence, and it's not just since COVID. This has been going on for over a decade. We have seen a progression of the disease state of depression and anxiety and, really just pure despondence amongst our youth. And it goes across every demographic. And we had an opportunity pre-COVID to learn how we might be able to address that. And we were working with an innovative school district in Minnesota, which happened to be the largest majority district, meaning that they had 52 languages spoken in the school district itself, working with a preponderance of backgrounds, including individuals who came from refugee camps, who had significant trauma, all the way to the other end of the spectrum, where you would just say, hey, it's just an average American kid making their way through their school years and moving into their adulthood. But there wasn't a difference. We were seeing a correlating issue with, for example, suicide went from the number 4 killer amongst youth to the number 1 killer amongst youth in that period of time between right before and right after COVID. And it hasn't slowed down. And it's scary, right? So when we had this opportunity to look at this space, we discovered that we could use technology and use qualified, and properly registered medical services to not only identify the problem, but to immediately bring treatment and care. And this is a real shift to the way people look at this. Because if I were to tell you, you're going to find 30% of these kids have a level of acuity that needs immediate attention, there are a few things that are going to come to your mind. Oh, that can't be. Well, the fact is, it is. It not only is, but it has been reaffirmed over and over. The second thing is there's nowhere to put these kids, right? We're going to find more kids than we have services. What do you do? And really, it comes down to two choices. You're an ostrich and you stick your head in the sand and get scared every time something terrible happens in a school district, or you figure it out. And we decided we had to figure it out. We had to find out not only how to identify this effectively, to give individual students agency and privacy to share their own personal concerns without consequence. And I know I'm rambling a little bit, but I think it kind of comes together into a cohesive background. Kids don't have agency, right? They don't know that they can seek help for themselves. It's different than adults who are struggling with a behavioral health issue. An adult may feel an amping up of anxiety because of work or life pressures. They can seek help. Adolescents can't. They are afraid to expose their concerns for fear of retribution with the school district. Maybe they have turned to substances or other concerns, and they're worried that they'll be eliminated from extracurricular activities. They are afraid to let their parents know that they're struggling. They haven't really grappled with these things before. And so that first step is the hardest step for them, how to voice their concern. We identified a way that we could bring services directly to individual students and give them complete agency under HIPAA and total privacy to share their concerns with a qualified health provider and know that that information is only for the purposes of helping them with their challenges and that that help is real and immediate. And that ultimately led to the challenge of where can these services be provided?
Mm-hmm.
And that required us to create a clinic system. And we generated a clinic called Althing Clinic. And we began to delve deeper into this, which is now the largest health epidemic facing the country today, and to becoming the front line of this war really against the rising behavioral health concerns that not only affects individuals, but families. It affects our economy. It affects the longevity of individuals and communities. And as we began to learn our way into this space where nobody else is, it became more and more clear how horrific and how extensive this behavioral health product is, and this behavioral health issue is, and how early identification and mitigation can literally change outcomes effectively and economically. And that's really how we ended up where we're at.
It's an incredible story and journey that you've undertaken, and certainly looking in its totality, overwhelming in so many facets. It's overwhelming to school districts. It's overwhelming to local municipalities that are providing services, states that are providing services, even at the federal level. How did you pull that curtain back and start eating the proverbial elephant one bite at a time? I mean, because that is such a grand undertaking that it's had to have been like, overwhelming to think about, all right, where do we even start?
Well, we started by doing other types of services in school districts, helping kids with reading and helping kids with language and other challenges. We're really effective at that, and found ourselves identifying the behavioral health issue, but then you run into a series of concerns, right? So if you just ask kids with a survey, how you doing, they're unlikely to tell you, or they're unlikely to be able to understand how to tell you. And so we had to try to find a way, well, how can you provide a health service? Well, the first thing you see are statutes. What rights do individuals have to seek and consent to their own care? And like a lot of parents, our entity was surprised to find out, and happily surprised to find out, that 12-year-olds and older are self-consenting. Under statute in most states, those individuals can seek care for themselves. They don't have a car.
Right.
They don't have the language to go ask. They don't have the confidence, but if you bring it to them, if you give them that proactive opportunity and you just basically generously say, We welcome you into this space where you are 100% private and you're not talking to a teacher, you're not talking to a survey, you're talking to a person.
Yeah.
And this person cares. And this person wants to know how you're doing. And if you're fine, that's fantastic. Life can happen, things can change. We want you to know where to seek help.
Well,
But
in
your
that
friend,
age group, your emotional state goes up and down the
yeah,
spectrum in a given hour, let alone days or weeks, and depending on the outside stressors.
yeah. So, I mean, step one is understanding the problem and understanding where do you get to the core of the problem. Don't find it downstream. I mean, you know, emergent behavioral health concerns typically happen in early adolescence. And in most cases, they get progressively worse into young adulthood. You first look at where exactly, what is the extent of this challenge? And how do you, in a qualified manner, in a meaningful manner, don't just identify it, do something about it, right? So what we could operate in within statute became the first real challenge because we started with adolescents. Of course, we've evolved beyond that. The second thing is, how do you bill for something like this? Kids don't have money, you
Right.
know, and nobody's ever actually done this before. So that became, well, can schools pay for it? Well, we all know what's going on with schools. They don't achieve referendums very often. Budgets are being cut, even more so today than they were a few years ago. It's a scary world for them, and you're not going to come in with a solution, a product, even though it helps them meet their mandate. They can't afford these sort of things. So, of course, you look at a grant solution. Can you work with the state or the federal entities that can bring resources on behalf of those school districts to really make this change? And that in itself is a bar, a hurdle to clear. You have to make your case. As a for-profit company, it's significantly more difficult that they should help you fund something on behalf of those districts and those kids. And we were able to achieve that with the Minnesota Department of Health. Then that led to another problem. How scalable is this?
Sure.
The thing that people don't realize is that grants are sometimes every year, every 3 years, but you go back to that well. And grants are not a reliable way to solve problems. They also have a ceiling. They come with a number. And when you hit that number, you're done.
Yeah.
When you're finding kids actively considering suicide, and I mean, we will go into a health service and happy to explain how this works, but we'll find a young female student share that she's not feeling that she wants to live. She has found her mother's gun in her bedside drawer. Later, she found where the bullets were, and she had a plan and she would have done it now, except for she just didn't want to leave a mess for anybody. She was trying to find an opportunity. And honestly, this is a true story that we have been authorized to share, to end her life near the river so that nobody would have anything to clean up. And
Hmm.
it just destroys your heart to know that every school, every community has a number of these incendiary things right on the cusp. We were able to identify and intervene and stop that act of suicide plan. When we called and reached with her permission to her mother had no idea. These kids suffer in silence. And think about that in any school district. 1 in 3 of those kids is suffering in silence. We discovered that school districts, and all of them, they'll say, oh, we have mental health services available. We have a school psychiatrist. We have counselors. And they do. They have these services. It turns out that they effectively identify, give or take, 5% of the kids in need. And of that 5%, they effectively provide services to about 2.5%. That is the average nationally. So 95% of these kids who are struggling in silence.
Yeah.
And we know this is everywhere. And a grant doesn't give you the resources to pursue this broadly and scale it. And that's really, it becomes a passion when you find out from moderate depression to significant challenge, what you can do to help bring the care that these kids are entitled to them. So the next stage, and I know this is a very long answer, but you go from statutes to funding to, okay, who are the stakeholders? Who are those individuals who benefit? And would that benefit have a financial value for them?
Yeah.
What we learned from a study done by one of the major health payers, so that would be a health insurance company, the average time from onset of behavioral health concern to qualified treatment is 11 years.
Wow.
11 years from onset to care. During that 11 years, the average cost per person additional to the health payer is $1.8 million.
Wow.
So there's a stakeholder who is incredibly interested in preventative health. They are very interested in accessing a population that would normally not be visible to them. Adolescents can go under the radar until they're adults. Their health issues can continue to progress until such time as they get agency for themselves. And at that point, the concern has grown into something more significant and costly. There may have been,
Yeah, they're hiding what they've got. They've learned coping mechanisms that maybe are unhealthy, to your point earlier. I mean, there's a whole host of things that are potentially detrimental.
yeah,
And yeah, I mean it's clearly, an opportunity there.
well, it does cost a lot less to intervene early in the progression of a disease state in any kind of a disease. And for all of the controversy sometimes around how our health system works,
Mhm.
those health insurance companies, some in particular, are very passionate about solving these challenges for our youth. And they are very motivated, but on a personal level, everybody's experiences. They know. I mean, I know you could share a story. I know our listeners could share stories about the challenges that have occurred in their own lives, in their own childhood, and in the children around them and their own children. It's there every day. And there is a lot of people who want to solve it. The second thing is every school district has a mandate to be protective of their students and their staff's health. Now you can look at their eyes. You can see if they can see well. Can they run? Can they jump? Can they, do they have, do they have spina bifida or something, right? You can check these things. You can identify learning disabilities. Nobody has effectively given them a tool to identify behavioral health concerns. Concurrently, since my time in school, and we now spend some time in school districts, of course, with this, those environments have changed. The doors are locked. I remember when I was a kid, we go to lunchroom and some of the community would be having lunch. There was an adult table if they wanted to come and have lunch with us.
Yeah.
There's a system where you buzz in. Some schools have metal detectors. Many schools have officers standing throughout the hallways.
Yeah.
It is an eerie feeling to be in those types of environments. It feels like a war zone. There are people in there with
Well, in some
weapons.
districts, it is a war zone. I
It
mean,
is scary. Yeah. And those districts and those parents, they want to know when someone's struggling. It's not, don't let it get worse. Find out about it. If there's a way to reveal those concerns and assist, everybody wants that. You don't want to respond
Mhm.
after the fact. You want to be available prior to it reaching that state. And so there's another stakeholder. The districts need to graduate kids. A lot of these kids with despondence won't get to graduation. And when they do, they have no intent in entering our economy. So you can see a stakeholder in the district, you can see a stakeholder in the payer, you can see a stakeholder in the families, you can see a stakeholder for everybody because it affects our economy. And so by doing that, we were able to forge relationships, in particular with some of the more innovative health payers
Mhm.
to support this program. So the cost to the parents is $0. The cost to the school district is $0. The benefit is the one that the kids get that they're entitled to. Okay, now the next major hurdle is the one I brought up earlier is when you're going to find this many individuals struggling and needing help and not enough resources to provide that help. How are you going to do that? How are you not going to identify and leave them floundering? You got to identify and treat.
Sure.
So AIRS starts with a universal assessment. So we take on thousands of kids in a week. We've added the staff. They're included. The adult staff is included. Everybody under the roof of those districts, every staff member, from janitorial to teaching to administration to lunch, doesn't matter. Bus drivers, everybody, and provided them with this care at no cost. They receive a benefit. The insurance payer gets information and is able to intervene sooner and reduce the cost to themselves over time. The individual students, whether they are the ones with the challenge or their colleagues are, achieve a safer, healthier environment.
Mhm.
And this helps progress these kids in and beyond the space that where they're supposed to have a comfortable childhood and learning.
Yeah. Talk a little bit about the program and what you do, so that there's an understanding of like that assessment, and then how you intervene, and then move forward through the program.
Yeah. Well, so the next, and I guess the last block in this building is you have to have a qualified clinical service. Healthcare requires clinicians. It requires a significant amount of registrations and qualifications. This is not a trivial how you doing. This is a direct encounter for every individual participant. Everybody sees a healthcare provider. Everybody gets the benefit of the insights of a provider, especially when they have concerns. And this is the second part that I was kind of rambling into, is this is also how we can help those individuals who have need get referred that same day to a service that can give them help.
Yeah.
So we did create a clinic, and it's called Althing Clinic, and we created this program kind of in conjunction with the clinic called AIRS. So using a technology, it's the only FDA qualified handheld system for engaging patients that helps those individuals who hold that device enter into a clinical experience that meets all regulatory requirements for a clinic, to privately meet with a provider, to openly share their concerns in a way that is comfortable to them. The system matches their race, their gender, their culture, even their language. So an individual entering into this space with this technology is provided a platform. It's not a tablet, it's a medical device that is 100% safe and secure, that the minute they hold on to it, hello, Justin, I'm here to talk to you a little bit about some health concerns that may be interesting to you, and I would like to help you understand what I want to offer today. It starts with
Is it a person on the other side, or is it initially just
a hybrid.
yeah.
Everything we do is in Althing is a hybrid. So maybe the best way to explain this is if you're the student. Okay, Justin, we'll just say you're the student.
Yeah.
And how does this actually happen for you and your classmates? So let's make you a 10th grader, right? So you're in 10th grade, you're in high school. They let you know that next week there's going to be a health event, and during your second period of class, you will be directed to a theater room. Behind the scenes, Althing and the district have signed an agreement that helps us provide this service to you. We are a clinic. We are not operating as part of the school district. We are a proactive clinic entering into the district and offering it to you and your classmates, offering this health service. What the district will do is get you to this room to meet with our system and determine whether you want to do that. This is 100% voluntary for the patients. So that next week comes along, and you walk to this theater room. So just as an ordinary day, schools are able to do this really, really well. Students are fine with this. You walk into a room, and in the room, there's a licensed clinical social worker and one of the staff members from the school district. And in the front of the room are a number of these technologies. They're handheld devices. They have two handles and a screen. And on one of those screens, you'll find your name. They'll say, hey, can you locate yourself on one of these screens? And yep, that's me. Okay, will you take that system and just go find an open space up there and have a seat? Every one of the students comes in and grabs their system and sits down. And on that system, like I said, is their name. Briefly, the staff member and the social worker explain what this is about, right? Because students may have already heard, but they're not sure. So in brief, you are entering into a clinical service right now. This is offered to you and all your classmates and all the staff. We would love for you to share with us exactly how you're doing. And if you're fine, that's great. But this helps not only you, not only your friends, and not only your school, but other schools and other communities around the country. You're going to help direct how healthcare is going to be provided. You're a part of this. And so let's just get started. All you guys have to do is select who you want to work with. So then you look down at your system. It's called Fraser. And you get this choice. It'll show you, hey, who are you most comfortable with? You get male, female, racial match, language match. Oh, I like this guy. You tap on that person, and that person just says, oh, hi, Justin. So welcome to Althing Clinic. And then he begins to explain what this is about. we are offering for free this opportunity to meet with a health provider. In this, you have HIPAA coverage. You are 100% protected. Your school can't know, your friends can't know, your parents don't get to know what you share today. Basically, it's telling you as a 10th grader, you now have agency for your own healthcare. That is earth-shattering for 10th graders, right? You have something pent up. You have something you want to know. This is private, and this is an actual provider.
Yeah.
Then, so agency and privacy, and then, hey, this is meaningful. This is not just about one person, it's about everybody. And that's really part of, and I gave you a very brief version of a fully informed consent.
Yeah.
And so you say, yeah, I would like to proceed. And then, thanks. Let's get started and start asking a little bit about how you're doing. As soon as you say yes, in the background, you connect to our health system. In that same building are psychiatrists and psych NPs. Inside, in front of an interface, we call it the healthcare, the cockpit, the provider cockpit. They'll start seeing a list of students start to appear in there. And this is a force multiplier. This is you connected to an electronic medical record and you connected to a real provider who is really on site. And as you begin to share what's going on with you, your concerns or none, it begins to show indications of how you're doing that alerts the staff to exactly where you are at, whether it's your general health, your social determinants of health, your cultural interactions, depression, anxiety, suicidal ideation, self-harm, substance abuse, risky behavior. All of these sorts of things are done in a way for you. You're just interacting with somebody, a human. You're not reading, you're not filling out forms, but in this process, you're actually authoring your own medical chart. This is vitally important. So you, Justin, answer that you are having some concerns with sleep. You are feeling a bit of anxiety before your tests. This begins to generate a qualified score of how you're doing with your behavioral health. Your mental health, your depression will begin to score. And that scoring will begin to fill that electronic medical record and begin to alert a provider. That provider then will begin to initiate specific encounters for you to learn more in depth exactly what's going on, and may appear on your screen at that time and say, hi, Justin, I see you indicated that you're not feeling so great and you're taking medications, but you're not seeing anybody. I'm going to want to talk about this later, but can you tell me, where are you getting these medications? That is the beginning of an intervention. And this will be going on around you. Some students will navigate through somewhat quickly. Other individuals with more concern will have a little bit more interaction. It may include directed toward other types of encounters. It may include a direct chat with a provider. It may be face-to-face. By the time that we're through that 50-minute class, we have 40 effective minutes with the kids. Some kids will finish in about 12 minutes. Yeah. Other kids will take the better part of that 40 minutes. Well, what happens with those ones that finish early? Well, they exit what's called the clinic encounter. That's AIRS. So we're going to assess them. We're going to begin an intervention. And the referral may come later, but we begin an intervention. And if you have none of those concerns, you're fine. You get a lot of, but if things happen, this is who you look to. Here are the resources you have. And here's, if your friends struggle, here's what you can do, how you can be aware of these concerns and health concerns and so forth. And then when it's done, it says, well, that concludes our health encounter, but there's some other things we'd love to learn from you. And this goes into a different type of encounter. So think of it as they were in clinic, they finished a clinic encounter, now they're not in clinic. Yeah. But we don't want them to be sitting there staring at their hands or looking at other kids or being involved. So what do we do is we have sponsors. So the first person they see is Art Fry, who invented the Post-it note, another innovator. And he'll say, hi, I'm Art Fry. I invented the Post-it note. And I would like to know how you think about yourself. Do you see yourself as an innovator? Do you like to take things and make them a little better? Or do you like best practices? Look, I just want to go in, I want to do my job and get paid. Or do you want to make things differently? We want to know. And then you answer that question. In return, there's sponsor money for kids without insurance to get healthcare for free. Next one might be McGough Construction. Have you considered a future in the trades? Is so long as you pursue graduation and get to graduation, we would begin to get you into a mentorship. And we will help you stay in your community. We want you. We want to learn about how you see yourself. Do you see yourself going to college? Do you see yourself? And this begins to be interactions that keep these kids really engaged. And a professional athlete will come on and talk about calorie burn and healthy. But this is how we keep meaningful encounters with them. We bolster the resources for kids who need those resources while the other kids are privately continuing their clinical encounter. Now that assess, this is the A in AIRS is assess. We have already started some interventions. That 50-minute course is over. The kids move to the front of the room, they set those systems down, and they walk out. Each system automatically rotates to the next group of kids. And this is typically 40 to 50 kids at a time.
Yeah.
The next group comes in, they do the same thing. But of that first group, like I said, roughly 30 to 34% need a further intervention. That's really the challenge we have. There is a specific list that privately goes to the school office, and those individuals are provided a private call into an intervention face-to-face.
Yep.
Now, we've told the kids that some people will be called in just to ask them what they thought about the service. So you never know if someone's going in for further service or if they just were asked, how did it go? So that gives them plausible deniability and privacy.
Yeah.
Okay, so there's a lot of kids who are degrees of acuity. I have the emergent state of depression, or I have a high acuity and I'm really considering suicide, or I have substance concerns. You can see a broad range. So they'll come in and they'll sit down face to face with a provider who's already introduced themselves, and they will have a face-to-face opportunity to really get into the root of their concern. And this is where the medical acumen comes in. These are professionals. They're not me. They're really good medical people. And they say, we have resources in the community that will help you now. We have your resources in the school, or this is something I would like to see if I could involve your parents. Is there a reason I shouldn't? Or can I help you break the ice? And most kids, they just want you to break the ice. Most of the time, you just need to help. Their parents aren't ready to recognize this,
or have no idea, right?
Right. And some of these kids may choose not to. Mostly they choose to include their parents. But every one of them is going to get some sort of a referral. Here's your concern. Here's how to manage your concern. Here's who can help you. And then some will have to go to a much more intense ongoing service. They've reached a state where they need a lot of help. And that's just a fact. And we provide them with that referral to care. Here is where it comes into the really interesting aspect is we know everybody in that area who provides behavioral health care, all the major systems. We have direct admitting privileges to most of them. We can look at their calendars and say there's no appointments available for 9 months. Or we could say there's someone available here. Would you like to go there? Or you can choose to work with our own clinical services. We will leave them in the school district so that you can schedule it into your school day so these kids continue to have agency for themselves and say, every Wednesday at 2:00, you will come to this space and you'll meet with your provider.
Mm.
And that provider will be a hybrid. Sometimes they'll be using this interface that we create. Sometimes they'll meet with that person in person. But nobody will be left without a health support. Same time, the adults do it. Lots of rambling, but it kind of gives you the sense of how it works. All of their information has gone into a protected HIPAA electronic medical record. Every individual, whether they had a medical concern or not, has met with a medical professional. Every participant has learned about behavioral health. We help destigmatize the concern.
Yep.
We help them know where to go when life happens for them or their friends, or even their parents. Because these exact numbers show up amongst adults. It is amazing, but it's not just an adolescent thing.
No, 100% true. I mean, listen, Matt, that's heavy stuff. But it's also exciting to hear that there's an opportunity for success for the kids to, be able to advocate for themselves and choose a different path. It must be kind of wild for you to be the CEO and founder here. Like no 2 days look the same.
Yeah, like I said, there's a fine line between where, what the medical encounters are. Nobody gets to see this data. This is all private data, but I get what's called aggregate data. As a result of this, we can see how the school is performing across different age groups. Are they doing as well for minority populations? Are they doing as well as for socioeconomic populations? How are the 7th grade girls doing versus the 10th grade girls versus the 12th grade boys or something, right? Start looking at that and say, there are holes in your performance. There are areas of concern where the school could do better. Take this aggregate data, it's de-identified, and use it to get resources. Use it for grants. Use it for other things to help improve your curriculum and help get these kids the help that they need and know where to target this. This data becomes incredibly powerful. And I kind of slipped it in there a couple of times, but the adults have the same experience, and these teachers are struggling too.
Yeah.
This is a hard
Well, they're the
job.
ones that are day to day managing some of these behaviors. I mean, it definitely it could lead them to, create some poor life choices outside of school as well, right? I mean, that's certainly tough.
Sometimes it's really not a choice, right? Anxiety can creep up on a person out of nowhere.
Yeah.
And maybe a loved one dies and you suddenly feel claustrophobic. You don't know why. And
Yeah.
you can't come out of it, and it's okay. You can get help. But if you don't know, if you're afraid to admit, if you don't seek that help, it just gets worse, you
Yeah.
know. We also find things like kids who are not getting proper nutrition. We find kids who are being physically or sexually abused. We find concerns amongst the adults to some really, things that are hidden, things around us that don't have to be that way.
Yeah.
And so this comes to I guess the final block is scalability. Some schools have 15,000 kids. How do you do this? We're able to see all of them in less than 4 days, including the staff. We're able to do up to 72,000 errors encounters every 24 hours.
Hmm.
And we're able to do it without dropping the ball on any referral. And every one of those participants will see a qualified professional medical provider. That is really the beauty of this. We started off with agency and privacy. And I think implied, if not explicitly stated, proactive health has a very powerful ability to reach people who otherwise wouldn't seek care. Right now, you and me and the listeners amongst us, there are things that we have as medical concerns that we haven't done, whether it's maintenance health, whether we have aches and pains, whether we're having trouble sleeping, whether we have a back pain. What if someone just said, hey, you got a couple minutes to talk to a doctor about it? It won't
Yeah.
cost you a thing. Tell us what you're doing and we'll help you with it. That's what we do.
Yeah.
And it's different to say, how about you leave work for a few hours? Your kid's got some sports game afterwards, or you've got some things that you have to do at home, or you just can't get yourself to do it. Behavioral health concerns have the nefarious additional feature of taking away the will to go seek that help. If the help comes to you, you're willing, but if you have to go do it, you don't know where to start. And
Yeah.
this is a very important program that can have a significant impact on our population that, as we shared in the beginning, that has effects on ability to perform in school, to perform at work, to participate in our communities, to be safe. And, that's our passion. And that's our journey to get from what is this really? How big is it? How do we do this inside of them within statute? How do we do it with a way that we can afford to do it? How can we make it work for those participants and so forth? That evolution that I explained in a few minutes, which probably too many words, uh, happened over a period of about 5 years.
Yeah. I mean, the judges for the TAG Awards certainly saw the benefits to one saying it's a novel system to allow large groups access to proactive health. The ability to connect patients with providers is a clear benefit. Interesting idea in a really crowded space. Looking forward to the data and the ability to scale. Addresses a real world need and its effectiveness and the data of outcomes is something that we're really looking forward to are a few of the comments from the judges. Talking about the business side of things for a minute, because this is such a novel concept and you're already having success in Minnesota. What are the plans and how do you envision scaling beyond that ecosystem?
Last week, we were able to provide a service to wounded warriors in the Twin Cities as part of a national program. The VA recognizes the challenge of bringing care to their members rather than having their members seek that care.
Mhm.
In that service, we saw veterans who had never shared their concerns openly before. They provided us with a quote. It's one of our press releases that we clearly saved at least one life that day. And this program is going through the VA as a channel partner, right? And the other payers, like I said, there's a couple of payers who are very visionary. There aren't any that don't want to do this. There are just some that are really motivated and really see that they're going to move on this. We've partnered with them as channel partners. And we are operating currently available in every state in the country.
Wow. What are some exciting milestones that you're looking forward to? What are some of the next major steps for Althing Clinic?
Two, stronger collaborations with the payers, because ultimately, um, they have a lot to do with how well we can bring proactive health to people. They have their vision, and we want to match our vision with their vision, see where their pain points are. They know so much about this market. They have actuaries every day tracking this, and there's a collaboration here that we want to continue to develop. And the second one is we want to incentivize school districts. We want to find ways to provide them with resources, not only by getting grants as a result of the data, but reduce their costs and continue to strengthen them as a cornerstone of each of our communities. And so those are the couple of the spaces we've gone, and I've talked predominantly about where we started. And then you can see that we do airs in different communities in different ways. There are adult airs. So we do that. A lot of municipalities are signed up to do this. So, your county and city offices, first responders, firefighters,
Sure.
EMTs. These are groups who have potential PTSD that airs is effectively able to address, checking in after they have an encounter in the community. Going to senior citizens, airs for seniors, there is loneliness, there's depression, there's despondence, there's hopelessness that doesn't have to exist. It's helping to find out where they're at, and additional pieces around health concerns that are standard for them, safety, memory, other aspects.
Mhm.
Airs for athletes is one area where we've seen significant growth. So we've been invited to multiple tournaments. So, for example, the National Sports Center in Blaine, Minnesota sees 3 million unique visitors a year. We participate there to help those athletes identify their stressors, their use of diet and other things, and their vision for themselves, because that is a very specific subgroup where airs can make a difference. And
Yep.
so those are two major milestones for us, is to make this more universal and to make it more collaborative with those stakeholders.
That's exciting. What has winning the TAG Awards for MedTech, for being part of the class of 2025, what has that meant to the team? How has that galvanized the group to, see that, they're being recognized for all the work they're doing?
Well, as you stated at the beginning, we know each other. I just see you as a person who champions innovation, who has the ability to see the difference that small companies and big ideas make. And when I saw the invite, we were just super excited. We've never actually put it out there, so to speak. We've been pretty grassroots. We've been pretty much going point to point to point. This is a very highly refined service that is extremely regulated. And I mean, I kind of brushed over that, but we've really never taken the time to put it out there, and we've really not seen someone with the enthusiasm to try to recognize these. So that outreach was exciting for us, and to put it out there for the first time. I know our board and our shareholders are very excited and proud to be recognized in the TAG Awards. We have our friends and investors in Canada who are super excited about this. We have those people who have been participants in air services saying, what can we do to get the word out? And that was our first foray into that outreach. And we just got so excited for the chance to get it out in the open, and very appreciative for the opportunity for you to share that with us.
Yeah, I mean, it's our humble opportunity to be able to do that. I mean, you've created something that is, not just groundbreaking in terms of its, thought leadership and innovation, but the scale at which it's truly helping save people's lives is incredible. Improve their lives as well. I mean, it's not just save them; it's also improve them. So thank you for participating. Congratulations on all of your success. Matt, what's next? What are you guys looking forward to? What's next on your most excitement?
We want to solidify this more into the market. So yeah, that's really, we're in the middle of that growth model right now. We're in the middle of getting ourselves established more broadly. And at the end of the day, I think the work that we're doing is instructive to other entities trying to find innovative ways to help at scale. I think the future of healthcare is proactive health. I think the ability to bring it to the person in their day and in a way that's safe, that is qualified, is a model that we want to continue to grow. And there's a lot for us to learn in this space. And so I guess it's getting more clinicians involved, more, that's the other side of it that we didn't talk about, is how exciting this is for a clinician, right? I can, as a clinician, say, I'm not a clinician, just to be clear, but if I were playing that role, I don't have to chart all this. I can actually face all these patients. I can actually progress them directly and organically.
Yeah.
That's exciting. That is, I can go out and reach populations. I don't have to wait for them to come and find me when I can, you know what I mean? It's for those individuals, their passion is health. To say, I don't have to wait till there's an emergency. I can get there earlier.
Yeah.
And I can help influence their progression away from that disease state. Wow, right? So we're looking to add more clinicians and improve the clinical experience as well. I think we do a fantastic job of bringing this service, and there's a lot for us to learn still. And there's a lot for us to learn on scaling. And when I brought up collaborations, there's a lot of people doing interesting work here that we would love to bring our service into the fold of what they're getting done, and together see what more we can do, because this is a problem bigger than any one entity can take on. And I think we're trying to put our little dent in it. And I'm very excited that we're making that headway.
Well, congratulations on all of your success so far. I mean, there's probably 3, 4, 10 more interviews we could do out of this to keep digging into the data, the results, ways to improve, ways that it already has improved. I mean, there's a lot there. So this is really neat. I'm so thankful that you've taken the time to share your story today.
Thanks. Yeah, we have just as a sidebar, we have a podcast where if you were to talk about data, if you were talking about clinical experiences, the people who are better at it than me would be, they're the ones who share this. They're the ones who are really the front line to make this possible. I am so proud of our clinicians right now, and it is hard to innovate in a space that's so highly regulated. They have to have a mind around, hey, I want to innovate too.
Yeah.
And finding that type of a clinician that says, scale, yes. Innovative way of approaching, yes. And that's exciting. And so, yeah, if people want to learn more from the real experts behind AIRS, there is a podcast that they can look at. And
what's that called?
Well, if you go to Althing on YouTube, just search Althing, Althing Clinic, you will find us right away.
All right, and awesome.
You'll see a lot of clinicians talking about the challenges, telling the stories about their experiences. You'll see some of the participants as patients talking about how meaningful this was to them, and continuing to share our progression. It's open for everybody. We want to share solutions to compelling problems.
Absolutely. Well, we'll definitely link to that here in the show, and stay in touch with the new iterations, and as you continue to evolve and improve and iterate and change the lives of so many that you've touched already. This is really cool.
Thanks so much for the TAG Awards, and thanks for everything you do.
Well, I appreciate you joining me today. On behalf of my guest today, Matt Johnson, CEO and founder of Althing Clinic, you've been listening to Tagged Beyond the Award.
On behalf of our guest today and host Justin Starbird, thank you for listening to Tagged Beyond the Award. We hope you've been inspired by the stories of innovation and leadership shared today. Don't forget to subscribe and join us for more incredible journeys behind the breakthroughs. If you or someone you know is leading the way in innovation, visit tagawards.co to learn more about how to get involved. Until next time, stay driven, keep innovating, and keep reaching for excellence.